Great, here we go. So I'm going to jump in because we have a qualitative design and we have lots of words and lots to say. So I'm going to jump right in. Before starting, I wanted to acknowledge that I don't have any conflicts of interest, to thank the ERC for this support, for funding the study, and then also give a big shout out to the rest of the study team, including 2 of our occupational health nursing PhD trainees, Miley Mercer and Catherine Lee Blazar, as well as Kathleen DeMarco, who's the System Senior Director of Nursing Wellbeing and Resilience at NYU Langone Health. So by way of background, we know that shift work and scheduling are major contributors for occupational stress for nurses, often leading to job dissatisfaction and risk of turnover. And nurse scheduling processes are complex because they're dynamically linked to nurse staffing and patient demand. And there have been few studies that have explored what and how work scheduling impacts both staff nurses and the nurse managers who are responsible for scheduling them in a post-pandemic environment. So this study sought to describe the barriers and facilitators of job and scheduling satisfaction among staff nurses and nurse managers. So we used a qualitative descriptive design, and the conceptual framework that sort of undergirded this work was Harvard Center for Work Health and Wellbeing's conceptual model for integrated approaches to protecting and promoting worker health. And in one of the pathways, scheduling practices are part of this process that can lead to interventions that improve worker conditions, worker safety and well-being, and enterprise outcomes. So this model helped to inform our interview guide and our overall understanding of the key domains associated with scheduling satisfaction. Our sampling frame included staff nurses and nurse managers employed at a large urban academic medical center. After IRB approval, we recruited participants with multiple approaches, including targeted emails, infographics, and snowballing. And we employed maximum variation sampling to recruit across unit type, shift work, work experience, and sociodemographic characteristics. Our participants were directed to a REDCap link where they were screened for eligibility and completed informed consent. They completed a short survey and then they self-scheduled using the Calendly app. Our participants completed interviews between August of 2023 and February 2024. And we used Zoom audio only interviews. They lasted approximately 35 to 60 minutes, and participants were entered into a raffle for Amazon gift cards for their time. After all of the audio recorded interviews were downloaded from Zoom, they were transcribed, checked for accuracy, and coded using Atlas TI. And we use conventional content analysis for this data set. We followed Lincoln and Guba's criteria to assess for qualitative rigor. Describe the interconnectedness between their schedule and physical and mental health, their overall job satisfaction, and their career intentions. And this led us to have an overarching theme titled Scheduling is Everything. And one participant described that they quote unquote plan their life around their schedule, while another one said, I believe that if people are able to have a schedule that works for them, that makes everyone happy and keeps everyone enjoying their job. And the last quote here to exemplify this overarching theme was that the schedule is number one. It really dictates the quality of your life, your well-being, what you're able to give to your work, your attitude when you show up, your attitude when you leave, and the ability to see family and spend holidays and things like that to balance your weekends. So schedule is everything. I'm going to go through our barriers and facilitators next, which were our sub-themes. And we had 3 sub-themes that were barriers. The quotes that I'll play are direct quotes from our participants, but they're not the actual transcripts from the interviews. They're from our study team reading that. So just wanted to make sure that that's clear. And I'm going to figure cross that the audio works. So we had 3 sub-themes that were barriers. And the first one was titled Tensions in Horizontally and Vertically Meeting Scheduling Demands. And the staff nurses generally perceived that their scheduler was prioritizing daily staffing demand based on patient census over the individual staff nurse schedule. And so this is how one nurse described this tension.
It seems like there is an emphasis on looking at the schedule vertically to make sure the unit is covered, but they're not necessarily looking horizontally to see how that can impact the nurse.
So they were saying that they could see how the manager might just be looking down the day, down the shift to make sure that they had enough staff to cover the patients, but not looking across the whole schedule to say, oh my goodness, this nurse is working 4 12-hour shifts in a row, or they're working every other day. And so then that could lead into our next barrier, which was related to health and well-being. And in this prioritization of scheduling the needs of the unit, often led the schedules to negatively impact the nurse's health, home life, and even the quality of care that they were providing. And one nurse spoke of the toll that it took for her to work 3 consecutive night shifts. And this is what she said.
I have literally a migraine for the entire day after that 3 shifts in a row just to gain my regular biological clock and come back to the normal routine. We have a lot of people on our floor that don't mind it because they go home, they sleep, they take a shower, and they come back in the morning. It's not bad for some people. For me, I have a lot of things to do at home, and it just doesn't work for me. But I know that a lot of people want to do it.
And then finally, our third barrier was linkages between scheduling and staffing on turnover intention and work-life interface. And the participants identified their schedules as incredibly influential in deciding whether to stay, leave, or change their jobs, both within and outside of their current organization. One staff nurse reported considering leaving a job that she loved due just simply to the dissatisfaction with her schedule. And then work-life interface was another piece that we can hear here.
And for people that have kids, one of the girls on my unit, for example, the other day her child said, "How come daddy only comes to my games? How come you miss out on my soccer and baseball games on the weekend?" That's hard to hear.
It seems like there is an emphasis.
So next we'll shift into our sub-themes that were facilitators, and we had 4 facilitators. And these were really across the interviews. We found that participants identified facilitators of scheduling satisfaction, which were endorsed by both the nurse managers and the staff. The first was around scheduling flexibility, which wasn't super surprising that when nurses had more flexibility, that they were more satisfied with their job. So here we hear one example.
I find that if a nurse is aware that they need a specific date off, like 2 or 3 months down the line, they've been pretty good about giving me the heads up. Then I can talk with the other staff if it appears that for whatever reason other people want that day off. I can say, "Hey, so someone needs this day off. Are we able to have any flexibility?" So I attempt to get the nurses to work with me and I work with them and not against each other as a team effort to get to balance the schedule.
And that was a quote from a nurse manager, if that wasn't apparent. Another facilitator was around having scheduling autonomy and control. And this was really participants describing that to the extent that they were able to have some insight to have a timely schedule come out, that they had some idea of the schedule that they might work was really beneficial.
The positives are knowing that at least 85% of the days that I indicate I'm available to work, I usually am assigned to those days. It's good to know that it works out and to be able to kind of plan your life outside of that too.
Our next facilitator was around transparency and equity, and that really being important to the staff nurses. So they really wanted to know if they put in a scheduling request and they didn't get the schedule or the day off that they wanted, that there was some sort of transparency around how that decision making was happening, and that it was, the days that people had to work, even though they requested not to, that was being equitably distributed across the staff.
They have access to the schedule. They're able to pick the days they want, are able to have a discussion with their coworkers before it comes to me.
So that nurse manager was describing how she tried to facilitate that. And then our last sub-theme was around trusting in the staff, that they could really be innovators and they could come up with solutions in terms of the scheduling process. And I think some of this came out of the experience of working during COVID and changes in work, seeing other people having changes to their working processes and their work life. And really the nurses taking on an identity of innovators and thinking about ways they might come up with solutions. So here's one example.
Things happen like you will have to go to the doctor at some point. You may need to take care of something at 6:30 a.m. On a certain day, you just make it up with the nurse. Be like, is it okay if I come in at 8 or 9 a.m. and then you could just come in at 9 p.m.? So you're both getting your 12 hours in. We're still covering each other as long as someone's taking responsibility for the patient. The positives are knowing that at least 85% of the days that I indicate I'm available.
There we go. Okay. Oops. Sorry about that. Okay. So in summary, these results really how scheduling and the scheduling process can underpin satisfaction at the level of the individual, the manager, the enterprise, and it follows our conceptual model guiding this work. We were really excited to do this work because we're working on a larger grant proposal that will evaluate the development of an in-house scheduling app with our clinical partners. And they wanted to know what they should include in the app and what were some of the guardrails that they might include in. So this was important preliminary work in the development of this proposal. We are working on our dissemination activities already. We have a paper under review with our main findings in the Western Journal of Nursing Research, and there is a special issue that we submitted this to focused on shift work and sleep, and it's guest edited by several other occupational health nursing program directors at different ERCs. So that's really exciting. And we also have additional dissemination through conference abstracts and presenting our findings to our local clinical partners. So thank you so much for your time and attention. I'm happy to answer any questions.